Welcome, my name is Bengt Andersson and I work at the Nordic Welfare Center in Stockholm, and I'm sending here from Stockholm in a studio. Usually I do this together with my colleague at the Center of Rural Medicine, Niklas Forsling, but he is in Copenhagen today. This is, as I said, the fourth and final webinar of this VOPD series that we do in the project Healthcare and Care through Distance Spanning Solutions in collaboration with Northern Periphery and Arctic Program. And Niklas, how are you down in Copenhagen?
Yes, I'm very well, thank you. Looking forward to this day and to this final fourth webinar that we're having in our series on technology use for COVID-19 response.
Yeah, and I will share the screen right from the beginning here. Let's see if I can fix these technicalities here. There we go. As we said, this is a part of the Healthcare and Care through Distance Spanning Solutions, and the headline for today is the future of healthcare and care. What is the bottleneck? It is an innovation track that we are doing today, and you will listen to me and to Niklas all through the seminar. And this is the program. I'll start with a short introduction. I will take you through wearables. Then Niklas will go over and talk about response services and also about a large project going on at the Center for Rural Medicine, system solutions for integrated healthcare and social care. And then there is, we're going to have a small discussion and a short sum up. And you please put in questions in the chat during the webinar. We will take your questions and I'll try to answer them as good as we can. Just a little briefly, most of you, I think, that are looking at this today, with us today, have been with our earlier webinars, but I think I said just a little bit about the Nordic Welfare Center. It is an institution under the Nordic Council of Ministers. We have office here in Stockholm and also in Helsinki, and we are around 30 employees. And Niklas, maybe you should say something about the Center for Rural Medicine.
Mm-hmm. Yes, Center for Rural Medicine is a small R&D unit within Region Västerbotten. We're based, our main office is in Storuman, Sweden, and we have around 15 employees, mainly in the northern part of the Swedish region. We are an R&D unit funded mainly through projects, and we have approximately 4 million Swedish crowns in core funding. So that's a little bit about us. Bengt, should we take the next slide?
Yep.
Thank you. Yes, webinar 1. I thought that we give a short recap what we have done so far. So we have had 3 webinars before related to healthcare and care through distance spanning solutions and this technology used for COVID-19 response, which is the webinar series. This is done in cooperation with Northern Periphery and Arctic Program and a project called Tech Zones, run by Professor John Condell in Northern Ireland. So we have, what we did at first webinar was that we were looking into the different solutions that are existing. A question that was posed by the Northern Periphery and Arctic Program was what e-health solutions already exist and what should be put in place. What are the technologies with the lowest threshold? What we think is that we have a publication that demonstrates 24 solutions that are existing solutions, that are services implemented, available for the population in the Nordic countries. And this is based on a comprehensive mapping of approximately 300 different solutions. And it's also available in English for download. So this is something that you can find on our website, and you see the website address at the bottom there. Bengt, if you take the next slide, please. The second webinar was we called Roadmap for Service Innovation. And that webinar was related to how can technology be brought to those people who need it and don't know how to use it. So what we have done is that we, in our project, Healthcare and Care through Distance Spanning Solutions, the priority project of the Nordic Council of Ministers presidency of Swedish presidency, was that we have looked through all the different strategies that are out there in the Nordic countries, and we have fallen in love with a strategy called Roadmap for Service Innovation, which is developed in Norway and is applicable for actually any digital transformation processes that are going on in public sector or private sector. So it's very much focused on change management, and we have decided that this is the solution this is the strategy to apply, and we think that this is viable for all Nordic countries and beyond. So we have translated this into Swedish. It's also in English for download, Danish and Icelandic and Finnish version coming soon. Bengt, if you take the next one. Yes, what we also were looking into was a question posed again by the Secretariat of Northern Preferred Nordic, was how to fast track innovation. And to be short and blunt, you need to be careful here. You need to follow a strategy and you need to do it by the book. We have tested this on 52 municipalities that wanted to implement distance spanning services and 8 healthcare regions across the Nordics. And what we see is that many people are trying to cut the corner when implementing distance spanning solutions. They go directly to technology and the idea of what type of service they want to provide, rather than to go into the first 2 phases of Roadmap for Service Innovation, anchoring and insight, which is the critical part to make any service successful and viable over time. So that's the past. Bengt, could you continue with what we see today?
Yes, I will. Wearables is the future of integrated healthcare and care at your wrist. Yeah, that was a question we put we set up and have been discussing a lot in this project. We looked at our 24 solutions that we have that Niklas just mentioned in the publication, Good Care and Healthcare, no matter where you live. And wonder if these kind of solutions, could they be exchanged to using mainstream wearables instead? We see that there's a lot of these wearables, very popular wearables for each and individual using this, not only for practicing training or keep fit. You can go in and look for how you're sleeping and the exercise you do each and every day. And could these wearables be exchanged the technologies we have right today? So we've been looking into this to see if, for example, the telekit solution for patients with COPD or with heart failure, if there are wearables that could give so much information that then we have now special technologies for, or night surveillance using webcam. If a person has this kind of wearable around its wrist, instead we could see if the patient is sleeping or the person is sleeping. And also these digital safety alarms that we have with GPS trackers, could they be replaced by these kind of wearables instead? We have, of course, a situation when it comes to these wearables. They collect a lot of data, and it goes back to the apps, to the platforms that are delivered from these companies, from Google Watch, from Garmin Watch, from Samsung and Fitbit. But how could I get that information back to myself and use it best way, and also get it integrated into my healthcare and care? We did a mapping. We looked at the one that was on the market. Not everyone here, this is a disclaimer, this is not a way of comparing different wearables and the quality of their functions, rather to indicate the width of their possible functions. So we did this kind of mapping, looked if they could, what are these products could you get your pulse, activity, sleep, notification, GPS, log, SBO, apps, telecommunication, ECG, breathing, and etc. Because we see that a lot of these wearables, they do so much, they gather so much data, and they also gather quite quality of data back to my app and what I recommend me what to do. And could we see that these wearables are the future on in our healthcare and welfare system? And how should we really do that to incorporate and to be more integrated healthcare and care at your wrist? And what we see is that there is a lot of data that these kind of solutions give us. But where should we put the data? Where does it come in? Who owns the data of this? And can we rely on the data that comes from these wearables? And we are absolutely sure of, from the VOPD, from the Healthcare and Care at the Distance Solutions project, that this is the future. We will have these kinds of solutions on our wrist. But will it be mainstream products, or will it be delivered from the regions or the municipalities, and how can we integrate it? We know that there are caregivers today. There are companies, there are regions that use these kind of wearables right now in pilot testing to see how much they can be a part of their solution, and they are evaluating this right now. But we come back to who owns the data and how much must come into our system, and what needs to go into the municipal social document system, and what must go into the region's ECR platforms. Very briefly about that, but this is absolutely how we see the future, that we replace probably several of these 24 solutions that we have presented in our report.
Yeah, thank you very much, Bengt. I thought that I could ask questions from the audience. So you're welcome.
Have you seen any questions from the chat?
Yeah, please submit any questions that you have. What I think is interesting when you speak about the wearables is that this is a very functional device. It becomes, we have spoken in the previous webinars, Bengt, that healthcare will move into people's own homes in future. But what happens with wearables is that healthcare and social care is with you wherever you are, if you think about wearables. Mm. And Bengt, you have previously worked with this, especially with these alarm clocks that are in digital safety alarms and safety alarms, normal safety alarms in people's own homes. How do we see this? What is the perception of people using this type of solutions? If we take the simple solutions first, Bengt, the safety alarms. What about people?
Yeah, we see through studies that when we do studies done on this, this is really something people want to have. It gives them a possibility to feel secure, safe, and also free to do more what they can do. To go outside and to feel safe to go outside, knowing that if something happens, then someone knows where I am and can find me again. So we know that there's a big demand for these kind of solutions, bigger demand than what the municipalities and the regions can offer to most areas, in fact.
Yeah. So what we have seen, Bengt, is that we have seen some companies and some healthcare regions, as you mentioned, are making use of these wearables of different kind, but it seems like at this stage that the bottleneck or the challenge to integrate this into the healthcare and social services are bigger than the gain currently. What is your experience from that?
Yeah, absolutely. It is like you mentioned, and it goes back again to what you talked about with with the roadmap for service innovation to how to do the change management and to get these kind of service into the organization. Not so much really about the technology and so it's more about delivering new services in a new way. I think it's interesting if you take it from the perspective of COVID-19 as well, that they are coming up solutions in new wearables this autumn, winter, where you have a possibility to see if you've got fever, how your temperature. Also more solutions in when you can measure your oxygen in your blood, etc. So connected to COVID-19, of course, this has developed even further. So what the mapping we did, where you can find on our website, the slides I show you, they were made in March, April, and so it has happened a lot of things since then. But Niklas, maybe we should go on right now and talk more about the bottleneck here, because we can all these wearables and other solutions, they create a lot of data, and how are we going to take care of all these data in the best way?
Mm-hmm. So if you change the slide, please, Bengt. Yes. Response service bottleneck or game changers, this is section called. If you take the next one, please, Bengt. Well, this is an illustration that we have used earlier, and this is a way of explaining that if we have different type of devices that are connecting the clients, it could be a scale, it could be as wearable as we discussed before, but it could also be other equipment to measure blood pressure or whatever. It generates a lot of data, and if we have seen the regions, as we have explained in earlier webinars, the regions that have gone the furthest, they have a very integrated healthcare and social care system, where a lot of these devices are currently in place in people's own homes. And this means that when people are having these devices available to them, and the intention with that is also, of course, that they should do frequent monitoring. And when starting to starting to measure more frequently, this generates a lot of data. And the challenge is for many healthcare regions and social care regions is that you have to act upon the data that are generated. You need to know if you as a healthcare region have allowed your patients to use self-monitoring equipment. If a measurement is out of range, then you need to act upon that and to make sure that the patient can feel safe by using this type of self-monitoring equipment. And if an adjustment is needed, it could be medication, it could be other healthcare services that may be needed that these measurements that are out of range are indicating, then the healthcare region needs to act on this. So the challenge has been up to this stage that we see that many healthcare regions are testing different type of equipment, such as the telekit solution that we have presented in our 24 practical examples in the publication for, and that telekit solution is for COPD patients. We see them testing this and getting great results for maybe for 70 patient group consisting of 70 people. But what about how should we be able to scale this up to the entire population of COPD for that healthcare region, to go from 70 to 7,000 users of this? And then it becomes too difficult to manage. So what they normally do, since they don't have a system that are creating a response service or an automatic response, or have the opportunity to play with the thought of using automatic responses, is that they are closing these projects, even though that the results are very, very strong and demonstrate that the clients and the patients are becoming more safe and more empowered and use the healthcare system much less frequent than with the uncertainty of not being able to monitor themselves. So Bengt, if we take the next picture, please. Yes, I just wanted to underline also that response service is also how you organize response for instance, safety alarms in people's own homes or digital safety alarms. And we know that there are multiple solutions out there, multiple systems, and that many municipalities are coming together to actually provide this type of response service for specific solutions, but not integrated package of solutions. But generating data, as explained before, is also causing another challenge, is how should we deal with the data? But if you manage to find a solution on how to deal with the data, you could actually become more proactive. And this is what we see, and this is from Exote. We know that the legislation in Finland is slightly different than compared to other Nordic countries at least, which means that secondary use of data is possible in Finland for both innovation and for research to larger extent than in other Nordic countries. But what they do in Exote is that they are taking all healthcare data generated by private and public social service organizations as well as healthcare providers, and they, before sending this to the National Data Archive, they put this into a data lake, and they use this healthcare data to see when a certain individual in Exote is getting a measurement that is out of range. Then they get a ping to be able to stimulate the individual to act upon the data themselves. And this could be anything in their society. It could be that they get a training program from the football association or a cooking course to get the people back on track. So maybe, Bengt, we take the next one. Yes, I mentioned the legislation here, and we have we know that there is a legal review made by Nordic Innovation, a sister organization to Bengt's organization, Nordic Welfare Center. Nordic Innovation is it's also connected to the Nordic Council of Ministers based in Oslo, and they have this report, Bridging Nordic Data. And I think if you're interested in this field, this is a report that you should review. And it speaks about the secondary use of healthcare data. What can we use it for and for what purposes? And as I said, the legislation is a little bit different in the different Nordic countries, where maybe Finland has advanced the furthest to use it also for innovation purposes. So it's a good report to review. Bengt, next slide. Thank you. Yeah, so what we have done, and now I'm speaking a little bit from our side here from Center for Rural Medicine in Västerbotten, is that we have looked into how this current Swedish system looks like. So what we are seeing today is that we have social services and healthcare services that are implemented and performed in silos. It's very difficult to get to interconnect the healthcare data from social services with the healthcare providers generated healthcare data on the population. We should also say that these silos are dependent on also the legislation in Sweden. Of course, there is data protection and security and patient security that are in focus here. At the same time, what we see is that, for instance, self-generated data initiated by the patient themselves, such as a wearable, as discussed before, that is not possible to be utilized in social care services or healthcare services as it is today. So in the current situation in Sweden is that if a social care provider or a healthcare provider offer self-monitoring and self-care equipment to a patient, then they have to act upon all data generated, and the healthcare and social care provider is responsible for all the data. And there is no possibility to share the data between the social care providers and the healthcare providers. So Bengt, next slide, please. Bengt, next slide, please. Yes, thank you very much. So what we have thought of is to think of GDPR. We view that the effects of GDPR has not been seen yet, and the current structure, which doesn't allow the healthcare organization and social care institution to interconnect themselves. Maybe we need to use the citizens in between as a middleman for this. And GDPR allows any citizens to have registered data in any public or register that is where someone is keeping their data at their own disposal. And you could say almost like GDPR is a human rights act, and could, through a correctly tailored system, maybe empower the system, the citizens to improve their well-being. And this is now speaking from a healthcare and social care perspective. So Bengt, next slide, please. So if we think of a system in future where we could create a safe harbor utilizing GDPR, where healthcare data is stored for my own use, and I become the body responsible to present my healthcare status to my social care provider or healthcare provider, maybe this is the way forward. So we become responsible for our own health data, and by that we could actually get the complete picture on my healthcare status as it is today. This is, of course, thoughts that have been floating around for a period of time, but we don't see that many actors that are actually trying to create this system integrated with the healthcare system and social care system in our Nordic countries. But what we do understand is that maybe this is a kind of service that shouldn't be within the healthcare system or social care system. Maybe this is something that should be outside. So Bengt, if you take the next picture, please. Depending on how much you want to integrate this with social care services and healthcare services, you could always allow this type of measurement going on, and even attach units that are self-monitoring equipment, such as wearables, as mentioned before. And you could keep this in your safe harbor yourself, and you could generate, when you get the measurement that is out of range, a kind of what to say form that is for you to discuss with your social care services or healthcare services, depending on who is responsible. So you know what to say at a certain situation when being in contact with the healthcare services. And if the healthcare or social care services are interested on your healthcare data, then you could give, through a request by them, a consent to share the data set that they want to use. And by that, it becomes the responsibility of the healthcare services and social care services. The challenge here is very much related to, is this data held by the people themselves? Can that be considered as healthcare data, which social service organizations and healthcare service organizations can act upon? We know even today that between different healthcare situations, it's not necessarily so that a healthcare specialist care unit is bringing in the healthcare data from, for instance, primary care level, when it comes to making decisions on a patient's situation. Normally they do new measurements and try to create a new set of healthcare data which they can base the decision on. What we feel is that sometimes this system is creating a bottleneck. It doesn't provide the entire picture of the client and the patient and of their healthcare status. If we now start performing self-monitoring and self-treatment in much higher degree in our own homes and have wearables that are accepted by the healthcare system and social care systems, then that data should be included to get the complete picture on how a person's current health status is, because it's the history that is also important when making a healthcare decision at any given point. So Bengt, could you take the next slide, please?
Yeah, next slide, Niklas, is the next part of the session. So,
so maybe we could stop here. I see we have many questions, but could I mention one more thing, Bengt, before you start asking me the questions?
Yeah.
And I just want to stress here that this picture is then illustrated as if we want to integrate the healthcare data and become part of the healthcare and social care service. In our case, we're looking into this as well as keeping this outside the healthcare and social care service, more as a service to the citizens, so they could, through self-monitoring and self-treatment, or self-monitoring equipment at least, empower themselves and become more safe in their current situation if they're living alone at home, for instance. So there are different ways forwards here, the different routes that you can take, but somewhere here we believe that there is a clear innovation field that needs to be further explored. Bengt.
Yeah, I have a question that's connected to exactly what you said. How do you think that the citizen can drive the development to share data?
I think the key, if we speak about system like this, is that the system needs to be requested by the citizens themselves. I don't think that the citizens have realized that different social care situations and different healthcare situations are not making their decisions on the complete set of data. So it will be very much up to the citizens to request to keep their own healthcare and social care data at their own disposal in their own safe harbors, so they know that they have at least a complete picture of their healthcare situation.
Yeah, Niklas, you mentioned Exote in the southeast of region of Finland. There is a question: is there any existing example of how a region is allowing patients' data to be incorporated in the medical record system, and furthermore used as a base for the visit when the patient meets the staff? If yes, where and how can I get in contact with the project?
Well, Exote is not a project, but we know that they are even in the national healthcare data archive. Kanta now has opened up for including healthcare data generated by the patients themselves from different devices. And we know that the system that is similar to a Kanta system in Finland, where they store the healthcare data, but also have an interface towards the citizens where they could actually access the healthcare data and view their situation. A similar system is built at the national level, is built in Iceland, called Helsevera. And they also allow self-generated healthcare data to be included into this system. So there are systems of this kind. And this is a game changer if we come to that far.
Good. We have a couple of questions here connected to wearables, but I think maybe you could go on and then we pick up these questions about wearables at the end of this webinar to see that we have answered all the questions that we have here in the chat. But what do you think, Niklas? I think you could go on, talk a little bit about what's coming up, what you're doing in Västerbotten for the upcoming years.
Yes, if you take the next slide, please, Bengt. I will run through
sorry
this
about
quite
it,
quickly.
but a little bit slow here on the buttons, but there you go.
Yes, we are investing 10 million euros in future solutions now for healthcare and social care services. So Bengt, if you are taking the next slide. What we are, and the next slide, please. What we are working with at Center for Rural Medicine is that we're working with a primary care reform of good quality local healthcare. This is a primary care reform in Sweden that is one of the biggest reforms of healthcare in recent times, maybe in modern times even. If I should explain it briefly, instead of having a healthcare chain, good quality local healthcare is putting primary care as a center wheel in the entire healthcare service system. We should, through this primary care reform, reduce the number of visits to primary care centers. We should reduce the number of referrals to specialist care. We should reduce the number of emergency transport of patients to emergency centers. And our take on this is in remote and rural areas. So that's what we're working with very much. And if you take the next slide, Bengt. Of course, we do this internationally. We are a small center, but you heard we were 15 people, so we have to collaborate across the world, basically, in anything that we're doing. And if you take the next slide, please, Bengt. We have earlier development made that are quite innovative. We have developed a community room or a health room, a virtual health room, it was named initially. And this is a room where the patient goes to do self-monitoring and self-care activities. And they could also connect to digital meetings with the healthcare centers, etc., at these health rooms. Sometimes, at a few times during a day, they are also a few times during the week, they are also having social care staff helping patients if they want to be assisted with any type of measurements in this. Bengt, if you take the next slide, please. So what we have seen is that we need a higher level of integration of social care and healthcare services. And this will be very much built around the GDPR legislation and the opportunities outlined before. So what we have got is that we have got a project that are on the negotiation with the European Commission called CRANE. It's a PCP project, a pre-commercial procurement project. And this is where we are expecting to have a number of different industry consortium to come together and find solutions of this type. CRANE stands for Comprehensive Treatment of Chronic Patients in Rural Areas. So next slide, please, Bengt. So what we want to do is, as I explained to do before, is that we want to build an increased person-centered care and nursing system, and we want to contribute to empowering the citizens, move citizens from social care and healthcare to preventive measures. And we want to take the opportunity to increase the responsibility for their own health and public health public health as well. So we want a system that are empowering the people, that are engaging the people, that wants the people to act upon their own health in more active manner than what has been offered before. So what we are, a pre-commercial procurement is, in our case, procurement that will go through 3 phases. The first phase will be where we are using 9 months approximately to explain the system that we want to use. And then we ask 5 different consortium, at least 5 different consortium. We will fund 5 different consortium to demonstrate the design of the system that we want to use. And they get a small portion of funds, approximately 50,000 euros each, for making this design on behalf of us. And we are going to select a couple of these consortium to move further, to demonstrate the proof of concepts. And these 3 suppliers will get approximately 600,000 euros. I don't have the exact numbers here. It's slightly more, but I can't remember the exact numbers. But to build a proof of concept of this system. And 2 of these suppliers will go through and get a validated system for the healthcare regions of Agder, region in Norway, region Västerbotten in Sweden, and Extremadura in Spain. So this is a highly innovative project that we believe could be a way forward for us. If you take the next slide, please. Yes, I've mentioned most of this information, but as you see, the entire project is approximately 6 million euros, and 4,650,000 of these 6 million euros will go to companies to design the system. So it will not be much for us and our partners consortium that are consisting of 6 partners. It will mainly be to design a system. So this is an interesting phase that we're stepping into. We're expected to sign a contract on the 4th of February. Starting date is set to 1st of March 2021. Bengt, next slide, please. You could skip this one. And we could go to the next one. In addition to this project, we have another one called TIC. TIC is more preventing emergency care and the focus is on patients on heart failure. We are one procurer. The other project there we are the lead procurer, but here we're one procurer with other partners from Barcelona and Spain and Poland as well. So if we take the next slide. So here we have a slightly smaller PCP budget, 4.2 million euros, but a similar PCP setup, procurement setup, design phase, a proof of concept phase, and validation phase. And the main focus in this project is bridging the gap between offer and demand by creating new generation of market solutions to implement the integrated care approach to treatment of patients with advanced heart failure and coexisting chronic conditions, multiple morbidity. And this project is very much preventing people from using emergency care. As you remember, our primary care reform, good quality local healthcare, has a target of reducing the use of emergency care services by 40%. So this is a project where we are going to equip the entire chain of healthcare services out to the patients and their own homes to empower the patients, and so they can get response services much quicker and maybe more maybe more services that are preventive characters, so that they don't need to seek emergency care within 1 week after when we see the measurements going the wrong way. So that's the two projects that we are lined up that we are going to work with. I think I should mention also a final bullet point here. It's again Nordic Innovation. What they are creating is a Nordic digital health and medication platform, and this will be a kind of platform for accreditation, dissemination of and activity services for quality approved digital health apps in the Nordics. So this will be a kind of sandbox testing. At the same time, it will be a way of distributing apps that are related to healthcare services in the Nordics. I think the platform will be launched early next year by Nordic Innovation, and this type of infrastructure is important to be able to scale up the different type of service provision opportunities for healthcare regions as well as social care regions, social care actors, I should say. So Bengt, that was shortly what I had.
Yeah. Thank you, Niklas. Thank you very much.
Thank you.
We have a couple of questions from the chat, and let's see here. We have there was a couple of questions around wearables. I think just so we don't miss them, I think we should take them. There's one where one question was about if there are any wearables connected to working when it comes to elderly and social isolation and loneliness. And I don't know so much about that. Have you heard anything about that, Niklas?
No, but it is definitely a question that we know of and that we are careful about and understand. So this is something that we have also looked into slightly, Bengt, because we have made a scoping review on the effects of these type of distance learning solutions from a citizen's point of view. This scoping review will be launched next year. We think it's a very interesting findings in that scoping review. Maybe more research is needed, but at least we have a starting point for that type of discussion.
And there are also a question here about wearables when it comes to, what kind of solutions and technologies have the best quality and works best. And we can answer that. I can answer that directly. We don't really know that. We haven't seen that. What we did with this mapping was that just to see what kind of products are on the market right now and what can they do. So that's really the answer to that. Also to say that you can find this mapping. We could send that to you all afterwards, that you could get this presentation. It's just a PowerPoint presentation with the slides you saw and some other slides with a little bit more information. There also is a question to you, Nicholas, about are there any information available, a link or something like that about the crane project?
Oh, that is still under negotiation with the European Commission. And of course, once we have a contract, we will publish this and make this well known.
Yeah.
But it was just to indicate the direction that we are going.
Yeah. Yes, see if there was any questions I really missed here. I don't think so. Yeah, are there any list of other projects that we've been discussing? Okay, Niklas, it's 11:44. I put up the last slide again, I think, to see where we're. There we go. So, because we want to end up with say something about what's coming up for the next coming 3 years, wouldn't we?
If I take it very shortly, the first one, what we are going to do from healthcare and care to distance business solutions, we're going to continue for another 4 years, contributing to the sustainability agenda of the Nordic Council of Ministers. And our focus will be very much on a seamless healthcare and social care system, working with model areas. So if you are a healthcare region or a social care provider that wants to create a more integrated system for your citizens, we will demonstrate models in the years to come. And the reason why we choose this is because we see this, the regions that have gone the furthest, they are making this happening now.
Yeah.
Yes, we should also say maybe that all webinars are available at our website, healthcareatdistance.com. So you could always go in there and watch the webinars afterwards. We haven't yet published all the presentations, but we will do this in a short time span, at least before we go on holidays now.
Yeah. So you won't get rid of us. We will be on for another 4 years and going on with different kind of activities and webinars. And so just be aware. We will have contact with you and inform you what we're doing and going on for the upcoming years. Okay, Niklas.
I see a question here if there are future scheduled activities. It's not yet. The reason is because we need a kind of approval by the Nordic Council of Ministers for our project. And once that is done, we are going to schedule activities. And one thing that we are going to do is holding this type of webinars that we are having today. Or what do you call them, Bengt? The
webcast. We could change it to webcast maybe, I don't know.
So we are going to have this type of easy meeting that we are having. So we could continue to share the information that we collect.
Yeah. Okay. Have a nice Christmas. Everybody stay safe. Please stay healthy. Okay. Thank you very much. Bye.
Thank you very much. Bye-bye.